So Dr. Pushwant is holding the suture on the other side. Now we presume that the suture we have passed on the suture from one end and then it has come out from the other end. So you have got two ends like in any other suturing technique. Now key is to keep this not too long. This is the first stage and this is like an ordinary suturing technique. The second stage, hold the needle holder in your dominant hand and keep it on one side. Now the third stage is to take 4 loops. So 1, 2, 3, 4. So after taking 4 loops, this is how it will look. So 4th stage is very easy. All you need to do is to catch the end on the other side. So after this stage it will look something like this. So the 4 loops we have caught the other end. In 5th stage all you need to do is to slide this knot over this suture and this is how it should look. If you look closely, this is how it should look. If you notice any knots, then there is something you have done wrong and start again. In 6th stage, when it looks like this, use your thumb and index finger to hold the knot like this. Now, the 7th stage is the most crucial stage. So you have to appreciate that we have got a loop here. You can see this loop is looking small, but we have got a loop. Now this is the trick. You need to keep holding here and then you need to pass this through this loop and then come out here. So just to make it slow, this is how it was. We hold this, we pass through this first loop and now you can see there is a second loop. This will come out here. So again it's like this, go through it and then come out through this loop. So once you have done it, in last stage let this needle holder go and hold the edge of the suture, but the key is not to pull it. If you pull it, this will lock the suture and then you can let it go. This is how it will look and then use a needle holder to just slide the knot. This is how it will slide and the other edge which you are not pulling, you can pull it now. This is how your knot should look and this is how to put a sliding knot.